So Marfan syndrome is a connective tissue disorder. It affects your connective tissue, which is basically what holds your body together. It's like the glue that holds your body together. In Marfan's, that glue is a little bit weaker than everybody else's. So it can affect the heart, it can affect the eyes, it can affect, in my son's cases, the feet. And with everybody, it's different. So it kind of depends on the person. But the heart is a big deal because they call it a life-threatening genetic disorder, because a person with Marfan's tends to have their aorta tends to be larger and weaker than most people's. So the doctors don't recommend people with Marfan's to get into contact sports or anything that can really give the person a big blow to the chest. So they have to be very protective of their chest area. It's like affected about 1 in 5,000 people. So, and it's a genetic disorder. So in my case, my husband has it. So both my sons actually, there was a 50-50 chance, and both of them ended up getting Marfan's. But with my husband, his parents do not have Marfan's. And we don't really know where the Marfan's came from unless it came from the womb, where that particular gene was just affected and he became affected with Marfan's. It was discovered by a doctor, a French doctor, like in the 1898, I think, Antoine Marfan, and he was the one that figured it out, that there was a connective tissue disorder. So he was the one that got it named after him. But as far as, I just know like recent famous people that might have it. I know there's a guy that's in a band named Of Mice and Men, and he's the lead singer and he's affected with it. And so I follow him on Facebook to kind of see what he goes through. Right now he's in the hospital, so apparently he goes through quite a bit. He's in the hospital quite often, so. Ehlers-Danlos syndrome is very much similar to Marfan syndrome. So a lot of people that have that condition tend to group themselves together with the people in the Marfan syndrome category as well. And so my husband, he's the one, of course, that is diagnosed, and he tends to ignore his diagnosis because I think there was a lot of things that happened to him when he was growing up. For example, my husband has the chest of a person with Marfan's can either be concave or it can stick out. In my husband's case, his rib cage sticks out. And so it seems to me like he likes to kind of camouflage that the best that he can, because he's had an experience where he went to a store once and was stopped by a security officer and told that he needed to check him because he thought he had something underneath his clothes. And my husband had to beat on his chest and explain, no, I have a pigeon chest is what they call it. And my mother-in-law said that when he was young, they said that they could fix it, but in order to fix it, they would have to break his rib cage, and then he would be on bed rest until the rib cage formed back together and the way it was supposed to be. And my husband chose not to do it. He was at an age where he just didn't want to get it done. On the outside, a lot of the time they look very normal, though. My kids do, anyways. They're tall and skinny, but there's a lot of kids that are tall. Some people, though, it's very obvious. You can look at them and tell that they have the lens dislocation. But with my kids, it's not as obvious. So I have to really go to the school, because now that they're school age, I have to make sure that they're aware of what's going on. And my kids recently have had certain things that have come up that have made it a little bit of a challenge. My oldest son has ADD, and in order for us to get him on ADD medication, which I'm not even sure I want to do, we have to have an echocardiogram, and he hasn't had one in 3 years due to cost. So I have just been trying to work with the school, and the best way to work with the school is to ask them to do a 504 or an IEP. And I had no idea what these things were until I like to talk to other people and kind of get information, and I happened to talk to a mother that told me about this. And so I initiated a 504. But the school has to agree that the child is in need of a 504. So they do in-classroom observations to see what kind of assistance the child needs, what kind of extra help the child needs. And then they meet with me and discuss what they've observed and whether or not they feel that we can go forward with it. We just barely had our meeting last week, and they did agree that Brighton does need a 504 and an IEP. So instead of medicating my son, we just try to do things at the school that kind of just help him focus a little bit better, or if he needs to get up and move around more than the other kids do, he has that ability. Redirect him, like have the teacher just kind of bring back the focus and help in that way. We also have to be very careful with PE and extensive. A lot of times they have field trips where the kids walk to where they're going, and my son gets really, really sore and tired from walking because his feet are really bad, and fatigue is also a symptom of Marfan's. So he doesn't have to walk if the requirement is to walk because of this condition. So we've made that available. The school nurse is aware. If my son were to get a sudden blow to his chest, say at recess, they have to call 911. There has to be an emergency plan for that. So we have that all in place at the school. It just requires a lot of extra work on my end as a mom. I think my boys are just barely getting to an age, my oldest one being 9, he's just barely getting to an age where he's aware that he is a little bit different than the other kids that's in class. And we try to have conversations with him about the fact that he's special and unique, and he can do this trick with his toes where when he points his toes down, his big toe points up. And I think it's hilarious, and he thinks it's hilarious, so he likes to share that. But I think at times he can feel a little bit out of place. And for example, in school, he has a difficult time writing. And I think that's because of his joint issues. So my teacher, or his teacher, said the other day that a kid was starting to tease him about it, and she was kind enough to just say, I have a hard time writing too, and that's just part of, what makes us different is sometimes some people it hurts to write with a pencil. And the kid kind of got quiet and didn't say much else. But I think the biggest thing is they just want to feel like everybody else. And they are like everybody else. Their mental state is not different. They are just as intelligent as anybody else. But to not point out any abnormalities is kind of a big deal. I get really worried when my son takes off his socks and shoes in front of his peers that they're going to notice how his feet are so different and start pointing it out and start teasing him. So I almost try to protect him from that, but I can only do so much, and I think if the biggest thing would just be to make them feel like they're not that different. Even if somebody's feet look different, they're still a person, they're still the same as everybody else. Then they just don't want to be teased. And I worry about bullying so much because I know it's kind of becoming an epidemic these days, and it would break my heart. And I know my son is so sensitive. It would break his heart if somebody were to point out his abnormalities in front of his peers, especially. So I just try to, I don't know if there's anything in particular to do other than just be nice. I think the biggest, hardest part with my situation in particular is my husband's lack of wanting to share what his experience is and kind of hide it from the world. And I feel like you're going to suffer more if you just hide what your diagnosis is. You have no control over what you genetically have when you are born. And the biggest thing that I'd like for my kids to learn is that nothing's wrong with them. They're just different. And they can have a normal life just like anybody else, and don't let that difference hold you back. Don't be ashamed of who you are, because they're beautiful. And they have so much to offer, just like anybody else does. And they're almost even in a better position because they are so unique. And I hope that they're willing to share and educate other people so that they can just kind of not feel so abnormal. I want them to feel very, very normal. And they are very normal. They just have different things that they have to learn to deal with. And just don't let it hold you back. I also encourage anybody who has this or may even think that they have this to follow up with medical care. It was back in the day when it was diagnosed, people tended to die at a young age. 40 was kind of the length of life that they would live to. My husband just turned 40 this year, and so I think I'm even more so paranoid about what the next few years may have to hold. And take care of your health. It's the best tool you have in life. So if you don't have your health, you're not going to be able to do much. So take care of yourself. So we knew with my husband having Marfan's that we had the 50-50 chance. I didn't do any genetic testing, but I know you can do genetic testing to see if you have that gene. And I know there's ways of making it to prevent your child from passing that gene, but we didn't go that route. We just decided we wanted to have kids and accepted the chance. So we informed the doctors. We did ultrasounds, but they can't really find anything on ultrasounds. So we kind of just had Brighton, our first son, and waited it out. When he became about 2 years old, or walking stage, so I'm sure it was like 18 months, he started walking, and we noticed that his feet were a little bit more flat, and not only were they flat, but they kind of curved downward in the ankle area. So by luck, my sister-in-law told me about Shriners Hospital, and she said that they're a nonprofit hospital that if you apply and get accepted, they can check out as it's an orthopedic hospital. So they wanted to check out. We applied and we got accepted, and we went up there and they did x-rays, and they did see that Brighton's feet were a little bit different, a little bit more flat and curved differently. And at that point we decided they had made braces to go on his feet, and they're little plastic braces that you wear on your foot that kind of comes up a little bit past the ankle, and it just like velcros on the foot, and then you put the shoe on top of the brace and you walk around like that. Well, I was pregnant with my second son at the time we got these braces, and trying to put the braces on a little boy at that age and be pregnant was a little bit challenging. So I was not, and we didn't go very many places, so I figured if he's walking around the house, I'm not going to make him wear anything. And there's a little bit of guilt that comes with that because I don't know if that made it more severe. But when I talked to the doctors about it, they were like, probably not, because chances are that connective tissue is going to break down regardless. The braces are just kind of trying to help shape the feet the way they're supposed to be shaped. But I think that life is just going to kind of make it happen the way it's going to happen regardless. So I didn't push the braces very much, and Brighton's feet have gotten continually worse and worse. From there, we were actually told about a study that was going on over at Primary Children's Hospital, and it was a study for atenolol versus losartan, which is blood pressure medication, and they were studying it in Marfan's patients because they wanted to see if a child was put with Marfan's was put on blood pressure medication, if that would help the enlargement of the aorta as the child grows. If the goal is to have not as much blood pressure going through the heart, and that way the heart doesn't stretch the way it would stretch if that blood flow was just doing its own thing. So we were able to get both the kids on this study, and therefore we would go up to Primary Children's. We would do Holter monitors for the kids, echocardiograms, and of course the medication, but it was a study medication, so we didn't know which one they were on or if it was just not a medication. So we did that for 3 years. And when they did the echocardiograms, they both have enlarged aortas, and that was basically the determining factor that they both have Marfan syndrome. And I think my youngest son was about not even a year when he was diagnosed, and my older one, they're 2.5 years apart, so he was probably about 2.5 years old when he was officially diagnosed with it. So we got a lot of help that way, because having Marfan's and having 2 kids affected with Marfan's can become a little bit financially of a burden. And echocardiograms are not cheap, and then all the Holter monitors and everything else can be, expensive. So I felt very blessed to be able to get them in that study, follow them for 3 years, and see how the heart was changing. And it seemed like the heart's been steady. It hasn't been changing much. And I think in early stages of Marfan's, that's generally kind of how it goes. But everybody's different, so you don't know who's going to be more severe or not. I'm sure in any rare diagnosis, this is kind of a big deal. Your child's going to require more medical testing and more medical care than most kids who are normal. We have commercial insurance. I work in the medical field, my husband works in the medical field, but we're just not high up in the medical field. And nowadays with insurance, you get a deductible, and they don't pay on any medical care until your deductible's been met. And in our case, we have a $2,000 deductible per child, per person in the family. So it's kind of like we financially have a hard time just day to day. So to pick and choose which child, okay, we're going to, let this child go get the echo and go see the specialist, and then we're going to have to wait on this child. I think that's sad. I don't want to have to pick and choose. My 6-year-old has had recent issues with his teeth. We took him to a dentist, and the dentist said that he has approximately $2,000 worth of dental work that needs to be done. Well, that in itself was a big surprise. But on top of that, because he's 6, he has anxiety when he goes to the dentist. And we, in order to fix his teeth, have to get an echocardiogram done in order for them to sedate him to get his dental work done. So we're adding on another $2,000 or so dollars. And it's just not feasible right now. So we've had to take that and just decide that we'll take one tooth at a time. If he starts to complain that it hurts, we'll take him in and get it fixed if we can. If we can't, we'll have it pulled because they're baby teeth, and hopefully he can just deal with it until he gets his permanent teeth in. But I have reached out to so many different people, and the Marfan's Foundation is a great resource. I highly recommend them. They do have conferences. I think it's once or twice a year, I'm not sure. And I just barely found out about that. And I think they do some echo screening at the conferences. But for us, where they hold the conference is a far distance. So it almost cost us as much to go to the conference as it would to just pay for them to go see the cardiologist. I've also been told to apply for disability for the kids. This wasn't anything that I really considered up until we got to this point. And I'm in the process of applying for disability, but it's a process, and it can either happen or not happen. And if it doesn't happen, then we have to try to figure out what the next step is. I have been told that it's probably a good idea to get a disability lawyer, because trying to work on disability cases by yourself is very time consuming, and if you do something wrong, you can get it denied, and then you have to wait and reapply again. Maybe, I don't know if there's a time frame that you can reapply, but I'm really, really hoping that this goes through so that we can apply for disability insurance and hopefully get some help through disability insurance instead of commercial insurance. And yeah, that's about what I've learned about it financially. It's always going to be a hardship, I think. Nonprofit hospitals like Shriners Hospital has been amazing. They see my kids every year. They don't give us a bill, and they do x-rays of their bodies. It started out with x-rays of the feet, and they even x-rayed my husband's feet because they were intrigued to see both. And it was awesome, and it's always been great because I feel like it's a huge relief on me financially, and it's also great to know that how it's progressing, to see what it's affecting, because it starts in the feet and then it works into the knees, it works into the hips, and you need to know the severity of what you're looking at as a parent, and of course as the person affected. It's you just don't know how much they're hurting. A lot of the times they probably don't even say how much it hurts, and they're just living with it because that's all they know. They have also been kind enough, like the last time we were there, I asked to speak to a social worker. And I'm always asking to talk to the social workers because they're your best resource to figure out what's out there, what kind of financial help you can get, if there's grants, if there's any kind of money that can help you get these testings done. It hasn't been super successful yet, but I'm going to keep trying. As much as it can be a little bit of a time-consuming process, it's always going to be worth it. So, with Primary Children's, we have reached out to their cardiology unit and social worker, and they have said, bring the child in, get the testing done, and then we can work with you from there. I just personally feel like that's still kind of a stress, because if we aren't able to get the financial help we need, we're still stuck with this bill. But of course, it's still something that we're thinking about doing. But I'm also in the process of working on the disability. Shriners, I don't know how many hospitals are similar to Shriners, but I know that a lot of people donate to Shriners, and they even have these coins of how much so-and-so has donated. When you go in there, you can see all these coins, and you're just so grateful that there's people out there that have the kind of money that they're willing to donate to causes like this, because I'm sure there's so many children out there that are in the same position we are. They just can't financially afford it. And to have a resource like that in orthopedic is amazing. If we could get it in cardiology, it'd be even more amazing, or almost anything you could request, because there's so many different conditions where kids need it. So I'm sure every state might have something a little bit different, but in Utah, that's the only specialty hospital that I've come across that really doesn't expect you to pay for their service.
And it's only for orthopedic cases?
It's only for orthopedic cases, yeah. So they would like to be able to help with the cardiology, and we had a lengthy discussion about it the last time we were in, which was just a couple months ago. And the doctor even went as far as to call a cardiologist, a pediatric cardiologist that she knew. And that's how I got in touch with a social worker in the cardiology department. But like I said, it was just kind of bring the child in, get them tested, and then we'll work with you and see what we can do. So I haven't gone there yet. So the biggest thing that I deal with as a mother is I would just love to have a resource available out there to be in touch with other people, to meet up with other people that have this condition. I think it's so important to have that one-on-one personal experience with other people that are going through what you're going through, so that they can also help you figure out what resources are out there, or even to form friendships. I wish my sons could meet other kids who have the same problems, so they could talk to them about it freely and not feel like these kids don't even know what they're talking about. You know, my boys are kind of excluded from a lot of things because of their hearts. They can't play contact sports, so that, you know, as a kid and a boy especially, you can't play soccer, you can't play football, you can't play anything that has to do with contact. And all these kids grow up playing these same sports, so they form these friendships. And I just wish there was kind of a way to do that without having to do athletics. And yeah, just if there's other mothers out there that can get in touch with other mothers, I would love to figure out how to create a support group, because I think it's important. And I just haven't gotten there yet. There are a few online Marfan's forums, but of course the people that are commenting on these forums tend to be the ones affected, and they're not usually younger. So I don't really get much insight as to children. It's more of the adult experience. And of course, as time progresses with Marfan's, your symptoms show up more and more. So what may not have bothered you a couple years ago can be a really big concern. And so it is nice to see what we could be facing in the future. But I don't really know what their experience is with children, and how to kind of form support, or, you know, get them the kind of care that they need to have. That I kind of feel like I'm left in the dark. If I could go to a conference like the Marfan's conference, I think that's a great way to meet others, to share time with others that are affected. And the study that we did end up getting invited to a meeting that I thought was going to be a meeting where we could meet all the other kids that were in this study with my kids, because we don't get to see them. We just go to the appointments, get taken care of, and then we leave. But when we showed up for this meeting, it was all doctors and hardly any children. I was kind of not excited to kind of make my kids sit through doctors doing just talking about, because they had slideshows, and the slideshows were actually bothering my kids because it was really in-depth look of what a dislocated lens looks like, the heart condition part of it. So I think my kids were a little bit too young to see that up close and personal. So we didn't stick around for that.